Once again, thousands of oncologists are heading for San Antonio and the annual Breast Cancer Symposium. What makes this meeting so important to the breast cancer community?
Well, it's the largest annual meeting devoted to presentation of new research findings in breast cancer research, both clinical trials and basic and translational research. And it's 33rd year, I think, now, so it's become sort of the standard for people to attend to find out the latest research results in breast cancer.
The build-up to the 2012 symposium has been relatively quiet compared with the excitement last year. Can you give us a preview of some of the Phase 3 trials that will be reporting results in San Antonio?
Yeah, I guess I didn't think of it as being more quiet, because to me, I think it's more exciting. There are several trials that I think are going to have a big impact. One is the so-called Atlas trial from the UK, which looked at the question of duration of tamoxifen adjuvant therapy. Two prior studies, although smaller ones, suggested that prolonging tamoxifen beyond 5 years to, say, 10 years was no more effective than stopping at 5 years. This trial is a much larger trial and looks at extending tamoxifen to more than 5 years, and it'll be interesting to see the results, to see whether it confirms the other two trials or whether it provides a different result that may wind up changing practice. In addition, in the HER2 setting, there's two extremely important studies that are coming out that will probably be practice changing or practice confirming, maybe. One is the HERA trial, where in HER2 positive patients, where patients were randomized between 1 year and 2 years of trastuzumab after their chemotherapy. And depending on that result, we might wind up either continuing to stop trastuzumab at 1 year, which is the current recommendation, or extending it to 2 years. And then at the same time, there's a trial from France called the FAIR trial, which looked at 6 months of trastuzumab versus 1 year. And so I think these two trials, one looking at a shorter duration and one looking at a longer duration, will help to set the standard of the duration of trastuzumab therapy in patients with HER2 positive breast cancer. I think both of those are going to be extremely important studies.
What are some of the other pressing topics? Will we be hearing about triple-negative breast cancer?
There's a session that includes several interesting papers on triple-negative breast cancer as we begin to define the pathways that are responsible for its development and progression. And then there's another study that'll be coming out that looks at another inhibitor in combination with an aromatase inhibitor, an ER-positive metastatic breast cancer. It looks at an inhibitor of cyclin-dependent kinase 4/6 along with an aromatase inhibitor, and we'll see if it provides similar data to the Bolero-2 trial using a slightly different drug and a different target. But that should be very, very interesting as well as we begin to learn what other pathways besides the estrogen receptor can contribute to breast cancer growth in patients with ER-positive metastatic disease.
Anything about biomarkers?
There'll be some trials looking at biomarkers in patients on the Neosphere trial. That was a neoadjuvant trial of the combination of trastuzumab and pertuzumab, which might tell us something about resistance mechanism or sensitivity biomarkers. And then similarly, in the Cleopatra study, there'll be some biomarker studies relating outcome to the biomarkers that should be of interest as well. So there always are some biomarker studies that'll be presented, and those are two that come to mind that will be particularly interesting.
Thank you, Dr. Osborne. Our reporting team will be in San Antonio for this important meeting, so I think we'll see you there.
Okay, thank you.
Thank you very much.